Hello, everyone. Thank you so much for joining. So just as a quick introduction for myself, my name is Mike Crook. I'm the Director of User Experience here at Medtrics. I quickly just want to say welcome. Thank you again for joining. Okay, so let's begin. So at this point, I'll hand it over to our host and CMO, Marcus Grimm. He'll guide us through today's discussion. Marcus, it's all yours.
Thanks a lot, Michael. Wonderful to have everyone on the program. I appreciate everyone showing up for this one. We're going to have a lot of fun today, folks. If you were with us last month, guess what? Last month's speaker was so incredible. We brought her back for a second round. So I'll be introducing our speaker in just a moment. Today's webinar is, of course, part of our MedEdge leadership series, where we bring in outside experts from the medical education community. Many of these fine speakers, including today's, have previously appeared on that MedEdge podcast that we mentioned. Feel free to look for MedEdge wherever you do get your podcasts. Today's program, Managing Evaluations in Graduate Medical Education. Little housekeeping first. Guess what? It's a typical webinar. You've got the ability to ask questions. We would encourage you to do so. We've got a couple polls in the program today. We're hoping they work, and we'll be able to share some numbers with you as well. And absolutely, as you can imagine, today's program is being recorded. Natasha and I are going to do our best to get you out of here on time, but if you have to leave early, certainly we understand. You will get a recording after today's program. A new feature also, there's a little survey at the end of this webinar. When you close out, we're going to ask for one question from you. So please fill out that survey so we can make future programs better for you. As I mentioned, today's program is Managing Evaluations in Graduate Medical Education. My name is Marcus Grimm. I'm the CMO for Medtrics. You know, when we talk about September, every month has its seasons, right? But I tend to think that September is one of those months that, well, it feels like a little bit more seasonal, if you will. Medtrics is based in Philadelphia, and some members of the Medtrics team, myself and Michael, two of them, it's the end of baseball season. So we're keeping an eye on those Phillies and hoping they go deep into the playoffs. Some of you might have already turned your attention away from baseball. Football season's just getting started. But if you're in graduate medical education, what season is this? Well, in fact, this is evaluation season, which brings us to today's program and everything we're going to be talking about with our host for today, Natasha Brox, who was with us just last month, and she's with us again today. More on Natasha in a minute. Now, we've got a nice mix for today's audience. We've got people here that I think are familiar with Medtrics, but we also have people that maybe have never heard of Medtrics before. So please allow me to spend just 1 or 2 minutes on who Medtrics is and what we're all about. In fact, Medtrics is a software platform for GME. With Medtrics, you can track academic progress, build schedules, map curriculum, run iris reports, all those great features. But beyond the features, the team wants you to know what else they bring to the table. That includes process development, making sure that you're actually managing your processes appropriately, training your team so they can use the software, and yes, giving you that industry-specific support. We're really proud of the fact that a lot of the people on the Medtrics team, they've been in your shoes. They come from medical education, whether that be UME, GME, across the spectrum. So when I tell you this is a sharp team, you believe me, this is in fact a very sharp team. I mentioned features, and boy, there's a lot of different features you can find inside the Medtrics platform, everything that you would want to use to measure your resident performance, everything from iris reports, work schedules. I'm not going to read them all to you. You see them all right there. And in fact, though, let's narrow it down. Today, we're not going to be talking about Medtrics at all, but we're going to be talking about evaluations and inside the Medtrics platform. In fact, that's exactly where you would do it, inside that evaluations and assessments module. And of course, this all comes down to milestone management and making sure that we as educators are doing the things that we want to be doing. So if you want to take anything that we speak about today, it's going to fall into those buckets inside that Medtrics platform. All right, let's welcome today's speaker to the program. She is no stranger to this audience. With over 18 years of experience in graduate medical education, Natasha Brox is the owner of GME Admin Insights. She's a dedicated professional with a passion for fostering growth, continuous learning, and mentoring. A compassionate and accomplished individual, Natasha is committed to both her professional and personal development within the healthcare sector. Having completed her undergraduate studies at the University of Arizona, she serves as a distinguished local and national speaker, Natasha also actively contributes to the GME community through her weekly newsletter on LinkedIn. She hosts a podcast titled GME Admin Insights. I don't know how she manages to fit it all in. This is all aimed at bringing about that positive change in the medical education landscape. Yeah, Natasha is just one of those people who she's in the trenches with you all. She's impacting lives. As Natasha's got her video up here, each physician you all train, that's going to impact 10 lives a day, 260 days a year for 30 years. That's why when we have people like Natasha at Medtrics, we say, how can we make them more efficient so they can do even more of the amazing work that they want to do? Natasha, welcome to the program. I'm so happy to have you back with us this month. Has it been a good month for you before we get started?
Thank you. Thank you. I am so happy to be here. Yes, it has been. Everything, it spirals. It just keeps, coming and coming and coming. But so far, so good. September is Suicide Awareness Month. So please look after, anybody that, has depression or, just struggles with that. But September has been a good month so far.
Wonderful. Well, I'm thrilled to hear that for you. We're glad to have you back on the program today. Natasha's going to be the one doing all the speaking here in a minute. I'll just be asking her my questions along the way. But we all sat down and said, okay, what are we trying to do with this particular program? We're going to be talking about those critical evaluations. So guess what? It's a pretty typical agenda, folks. We want to understand the critical role of evaluations in GME. Natasha's a big fan of asking why, and so am I. So I love the fact that we're going to sort of break down why are evaluations really important. That's a great one if you happen to be a newer coordinator to the program. Guess what? Getting those evaluation completion percentages up there, that's a constant goal. So we want to take a look at, first off, we want to see how do we measure that goal? Where are we? And sort of identify some of those common challenges that keep us from pushing that number highest. And then finally, once we've identified them, well, how do we actually fix them in the first place? So a lot to go over today. Natasha, let's get started. Let's break it down from the very beginning. What is an evaluation and how do you think about it in your day-to-day?
Everybody has a different perspective of really what an evaluation is, right? But when you really break down, like, what is an evaluation? It's a way of checking, right? It's a checks and balances, right? You can check what's going on, not just with the residents, but their learning, their how you're doing as the residency program, how's the faculty doing? Are they keeping up? Are they training them right? Do they have any issues? This is one way to really evaluate what's going on with the resident and with the program and your faculty. That's all, around what a evaluation is.
Can you break down for us you've got it there in the upper right, but I think, when we often think about, evaluation in general, the different types of evaluations we have, and we all have different software platforms to manage this, or if we've got a really small program, we might be managing it in Excel. But at a super high level for the new coordinators that are on today's program, how do you think about the different types that we have?
The different types of evaluation?
Yes. Yep. Yeah. So right here on on the slide I have up here, the evaluations. You mentioned here that we've got the formative ones and the summative ones.
Yes. Okay. Yes. I'm sorry. My thing is kind of off a little bit. So when you think about like evaluations, you have the formative is for the residents. How are they doing throughout the year? That's just giving you some information about where they are. We know with the 1, 2s, and 3s, they need to be within a certain milestones of their learning. So that is taken twice a year. The summative is the end of the year that groups everything together. All the evaluations that you took for the whole year, it groups at the end and gives them a summarized evaluation of how they did the whole year. So it stays with them throughout their career, because at the end of their graduation or at the end of their years, and you do that summative, this piece of paper is going to keep going and going with them. So with the evaluations, you really want to make sure that you know what type of evaluation you're doing, how you are putting it into play, and all the methods behind it.
It's interesting to me, Natasha, when we look at the methods on this screen, there is no, and this is kind of, I think, your central point, right? An evaluation isn't any one thing. It could be all these things. There's lots of different methods to do these evaluations, right?
There's too many methods. And the thing about it is, Marcus, you have to know what works for your program, right? Because like you said earlier, there's small programs, there's bigger programs. So when you really think about the method that is right for you, you know what you need to use, right? How you're going to work your evaluations, or how you're going to look at, the interviews that they came when they first started, or the whole data of what you've collected. So using different methods to evaluate your residents and your program is what is key when
Right.
it's all done.
And making it be tailored too. It's interesting. I was actually just looking inside a customer portal yesterday that uses Medtrics for several different specialties. And to your point, the methods that we see just vary from specialty to specialty. Some of them are doing many surveys, some of them are doing few surveys. And you've kind of taught me this, that it really is something that each program is really going to approach this in a unique way. And that's critical, right?
It is critical because our programs are not like a one fit all, right? It determines on the program and then the specialty. Emergency medicine is not going to be the same makeup as family medicine, right? Yes, per ACGME, we all need to lead down the same road, and they give us that framework, but every specialty has how they need to set it up and what they need to follow, all their guidelines. So it's not a one fit all at all.
That's outstanding. Let's take a step back. I think lots of times, so now if you're a new coordinator, we've introduced what is an evaluation. But I love, Natasha, I think that the first time we spoke about iris reports, you were so kind to me, and you mentioned to me that, coordinators really go down in the weeds on how to do these iris reports without necessarily having a clear explanation into why and how important they are. You've got a great slide here that I'm going to pull up now, which is the critical role of evaluations in GME, why we even do these in the first place. Let's make sure the audience is crystal clear on this one, because I love how you go through it.
So yeah, the critical role of we know that evaluations are the checking point and the tracking point for everything, right? So it's a way to check and keep track of, like I said, how somebody's doing, how you're doing as the trainer in the program, right? How you have things set up. So these evaluations help provide like feedback, show where the improvements are that needs to be made, if any. Patient care, medical knowledge, professionalism of residents. These evaluations, they help provide all this feedback to show, are you lacking or are you not, right? So we know that for the residents, these evaluations, this is their education. This is where they come to learn. And they need these feedbacks from our faculty and our peers. And we help them grow when we do that. So this is all part of, how critical it is, because you really don't want to send a resident out in the world and they have no knowledge of what they're supposed to do, how to do it, patient care, professionalism, talking to patients, and then they want to get into like academics and they don't know where, start. So continuous improvement in your evaluations is something that, we as a GME community needs to continue to do, because the evaluations is kind of like saying, giving the stamp of approval for a resident to go out there and take care of patients. And I always think, okay, if I give this stamp of approval, can they take care of my mom or my sister or, my family member? So it's very crucial when you're dealing with these evaluations.
You mentioned, and we're going to talk about this, accreditation and compliance as it relates to ACGME. ACGME tells us we must complete evaluations. One of the things that I think is interesting, in our next question, we're actually going to ask a poll question about completion percentages. But one of the things that, of course, you shared with me is there isn't really a magic number. ACGME just says you want to get a lot of these. You don't work for ACGME, Natasha, but you probably could, given your experience. What are they looking for there? Are they just looking to see that you are in fact measuring your resident body on a regular basis? Why does this matter for accreditation compliance?
That's our governing body, right? So they give us the policies and procedures, and we have to, deal with them. So when you think about ACGME, like if your boss tells you, okay, Marcus, for the whole week, as long as you make 500 calls within this week, you're fine, right? So we have to make sure by the end of the week, Marcus has 500 calls, right? So when you think about residency and the evaluations, we can't, when the resident goes, especially off rotation and they're with another physician, we need to make sure that, are they getting their education? When they're on that rotation, are they still being professional? Do they know patient care? Do they know the medical knowledge that the faculty is teaching them, right? So then when they come back and we get that evaluation and we see the remarks like, they argued at every patient, or they didn't know how to put in the ABCs, or, prescribe medicine, we have to say, okay, hold on. Something is not right with them, the teaching, the system, what's going on? Because per ACGME, we are responsible for teaching the residents this information. And that's where it comes in at. So when you have an ample amount of evaluations, let's just say, everybody's number is different, but let's just say you only have 5 for a rotation. Can you really look at those 5 evaluations and say, based on these 5, I know how this resident is going? Or do you want to look at 20, right? Evaluation, and then make your educational guess. So the more evaluations you have on that resident, you can better see how they are shaping up in their education. Are they lacking somewhere? If so, let's help them, let's guide them better. And that's what, when it comes to ACGME, that's what we have to look at. And that's why we follow those rules.
Terrific. It's interesting whenever Medtrics talks to a customer about evaluations, it always starts in the same place, which is a form that we create for the evaluation. And one of these lines that I heard years ago that I often think of whenever I hear the word form is, everybody loves to design forms, nobody likes to fill them out, which I think is the fundamental issue with evaluations. Like, we have to design these great forms, and then of course we got to get people to actually fill them out. Now, I thought what was interesting, though, is you offer a special framework for how you think about the form, and in particular the four stakeholders, if you will, that are involved with any type of evaluation. I never heard this framework before, so I want you to walk us through it here. I believe you call it Ryme, right?
Yes, Ryme.
Walk us through this form, this framework, and how we can use it.
So we got Ryme. So our medical school, kind of almost uses this for their medical students. So, I'm like, well, this is an assessment tool that I can use for my residency program. So when you think about Ryme, it's everybody has accolades and all this other stuff. So Ryme is report. So the rotation is reporting on the resident, right? Can they accurately gather information about the patient? These are things that we want to know about the resident to help them, in their career. And then interpret. Can the resident interpret? Can they organize information? Can they develop and prioritize the different diagnosis lists or pharmacy lists, that needs to be handled with that patient. And then can they manage it? Can they develop and defend, like a diagnosis plan that they're going to put together, or plan a therapy for that patient? And when you're in the ED, I can mainly speak about the ED portion of it. Like, you never know what's going to walk through that door. So you have to be quick, and you have to be able to formulate a diagnosis, especially if they're coming through trauma. If you have time, if they're lingering in the ED, that's one thing. But can our residents handle that? Can they manage this high speed, quick turnover trauma, Bay Area that they have to be in, right? And then educator, like, can they look at a problem more in depth and be able to educate the team and the patient on their findings that they find, or the plan that they're going to present? So that was our whole thing when we're dealing with residents, how we're going to set their evaluation. Those are the things that we wanted to ensure that they knew when they proceed through rotations, not just in-house or outside, outhouse as well, because, as they progress from PGY1 to PGY3, doing these steps, especially as a coordinator, we evaluate them on all of these, especially their professionalism. But when we do, we ensure that the assessment is fair and accurate, for them and for the program as well. So that's why we use Ryme. And if you look at that with anything that they do, you can get the basis of, are they growing as a resident?
I love that. That's a tremendous framework, and thank you for bringing that with us today. It's interesting, and we're gonna put some people on the spot. Well, we won't be calling them out by name, but we've got a poll coming up here. And one of the things that I think is really interesting is whenever we talk about, so if we think about today's program is how to do better with evaluations. And one of the things that we always look at Medtrics is, in fact, understanding what is your evaluation completion percentage. Now, why do we want to know it? Well, I'm a big believer, Natasha, that what gets measured gets managed, right? So we want to know where we are right now. Now, all of that being said, before we launch this poll, what I have seen and what we see at Medtrics is evaluation completion percentages, they vary significantly from program to program, school to school. So there really is, my central premise here is there is no right number. There's only the right number for you, for your instance. But you probably want to know that number so that whatever it is, you can continue to improve it. So Natasha, you and I were talking about launching this poll, and we were like, well, we don't know what's going to happen here, but you and I are both super comfortable with this framework. We've never done a Zoom poll before, so if this doesn't work, the audience is just going to have to forgive us. But Michael, you're there somewhere. So look at that. He's got a poll up there. And he's got the poll launched on your screen. So we're asking you, what's your program's current goal for evaluation completion? Listen, if you're one of those people who's at a higher level and you don't know it at the program specific level, feel free to give us an overall number. But here's what we currently want to know. Do you have a goal set currently, or what is your result?
Right.
All right,
Michael. With our program in emergency medicine, we're like, okay, we need at least 80%. These are the evaluations from all of the rotations. 80% per resident. So that way we can really see a big picture. And if it drops down 50%, then we're like, okay, what program or what resident or what rotation didn't fill out their evaluations? So like, we're getting on the phone, we're calling peds or, ICU, like, can you fill out this evaluation? So we like to have 80% of our evaluations for our residents. If it drops down, really it's 60, but really 50. If it drops down for that resident, it's like, who didn't fill it out? Let's go find it so we can have it.
Outstanding. So I'm going to ask you about those numbers again in a minute. Okay, Michael, how does this work? Can you show me the results on screen? I don't.
Yeah, I thought you were saying it. Sorry.
No,
We
no,
have, I guess I'll just read it off. So right now we're sitting at 31% for completion percentages between 90 and 90 plus. 40%, a little bit higher, surprisingly, 75 to 90, which is good. Okay. And then we have 60 to 75%, which is 6%.
Okay.
And then we have an option here for we don't have one currently set, and that's at 25%.
Really?
And folks saying that they don't know if there's a goal set, we have 0. So at least there's definitely some knowledge of a KPI there.
That's a great feedback. Thank you, Michael. I appreciate that. And I think, Natasha, correct me if I'm wrong, you and I are probably more interested in talking to that percentage of people. Oh, there it is. There it is on the screen. Thank you, sir. We don't have one set currently. That's really something that probably as a team, that's probably the most important thing we want to try to address, right?
Right. That's true. I like that. We want to, because if they don't have one set, then how do you go and get it? How do you go and find it? You need to set one. How are you, doing your like CTC, without any evaluations? How can you do the sub and the final evaluations without, these evaluations being turned in? So yeah.
Outstanding. So I think, if thank you all for participating in this, by the way. Great numbers right there. Definitely the actionable item is for those of you that don't have one set currently. Well, you can actually see 25% of your cohorts are putting the number at 90%. Big chunk of people have it at 70 to 90%, but the goal is definitely we want to have one in place. What gets measured gets managed. Love it. So now that's where our goal is. That's where our KPI is. And I think we can all agree that, well, yeah, some months we hit it, some months we don't. And there's a lot of potential different reasons for that, which brings us, in fact, to some of the common challenges that we face here. And these are the usual suspects that we have on the screen here. And Natasha, took a look at her battle scars and said, okay, so where's this hard? Where do we struggle? And so we have some options up there. I don't know who to approach to go after them. I'm unsure how to approach them. I'm unclear on when to approach. Is it too early or is it too late? Or I already do all these things, and this is where I am right now. So common challenges. Feel free to fill out what you kind of see on your end. And some of the things that I think come up, Natasha, and we've seen this with some Medtrics customers, is sometimes if you have a resident and they're on the floor somewhere, you may not know who the attending is. So therefore, that's where you get into, well, we're not always sure who to approach for these evaluations, which certainly can make it tough. Either you don't ask at all, or they just shotgun it around the organization. So feel free to take those polls as well. Natasha, as we wait for the results to come up, when you look at those options, is there one that you find that you gravitate more to yourself? Is it do you know who the people are, and it's just how do you work with them? Or there's the results up there. Yeah, so when to approach. Timing is a big one here, Natasha. And boy, timing is everything, right? Because let's think this through. If somebody if they haven't completed the rotation yet, you've reached out a little too soon, it's not going to get completed. But also, these people are then on to their next rotation. So if we wait too long, so good news is most people know who to go after. Some questions about how, and I think, Natasha, you've got some great tips coming up here and how to actually work with people as well.
Right.
What are your thoughts on the timing? When to approach? How do you think about timing for evaluations?
Well, and it all depends on like how you have your evaluation set up. So I know ours is automatic, it sends it out, but it doesn't get completed, right? So when I think about the framework of who do I need to go to, like who's the site director, First of all, was it put in right? Is it really the site director? Did they leave? Did they, hand it over to someone else? So I need to reach out to the site director and figure out what's going on. And then we do have some that are QR code, and the residents don't know who's the main person, especially in the ED. Like if they have, a lot of different attendees, who should I go to? So to get this QR code filled out or whatever. So we made sure to tell them, look, they're not the core, but give it to them. If they are not in, our system, then we can add them to the system. It's just, we just need to do that. But as far as the coordinator is concerned, it's like, who's a site director? Let me reach out to them. I don't want to do it when they're a month off of rotation, but I don't want to do it when there's only a weekend because they don't know them yet. So it's kind of like, it's like a juggling act of when do I need to make sure I get these evaluations from the faculty so I can have them together in their file and ready for CCC.
It's a great response. We actually got a comment from Carla. Carla, thank you for your comment. She sends out weekly emails. So again, I think what we learn over time is if people don't take these evaluations, they can just keep stacking up. So certainly sending out those regular reminders. Not every platform offers this. I know inside the Medtrics platform, we have the ability that the resident can actually request the evaluation as opposed to the coordinator doing it. Sometimes the residents, because they're out in the field, they might actually be able to unlock that timing trigger a little bit more a little bit more simpler as well. So great feedback right there. So we're going to keep going here, but great challenges. So let's talk about then what exactly we do about this. And what I like here is Natasha. So let's say, in fact, you've set your KPI at 90% or 85% or what have you. And now we look at the results and we go, okay, well, we've set it at 85%. Maybe we're at 60 right now. Well, what the heck do we do about that? And Natasha, you've lived it. So you have a nice framework here that I kind of to walk us through this.
So what we've done is we figure out, nobody's filling out these evaluations. So we have a brainstorming meeting. We get together, the PD, APD, and some core faculty of, okay, what can we do? We'll brainstorm different ways. And mind you, this is after I may have emailed the site director, emailed their assistant, coordinator, secretary, whatever. And they are still not coming through on filling out the evaluations. So we'll get together, we'll brainstorm. What can we do to get these evaluations handled and put back in? We will create other things. We'll test out, like, what if we do this? What if we, print it off and send them a PDF and then we go back in? It's all of that. You have to get creative, but you want to work smarter, not harder. That is the golden rule anyway. So you don't want to duplicate work. So we brainstorm, like, what can we do, right? Then we try to work with the site director. We try to even involve the residents. How will it make it easier to get these evaluations? Because we almost put it back on their back too. Like, if we don't have it, we can't really evaluate you appropriately, even though we probably could. But we give it back to them. Help us with this. So they're in our brainstorming efforts as well. And so all of us, we think about what can we do. They give us tidbits, they give us insights, and we can formulate a plan from there. But it's you're not by yourself. Usually a coordinator, you think she's by herself. How can I get this? She gets frustrated. She gets, especially when you've tried all you can do. And then my end result is, okay, my PD, hello, this is what's going on. I'm not getting these back. And that's when the brainstorming session begins to implement everything else. And then we will try and see what's tested and what fails and what doesn't.
My favorite bubble, I think, well, I love brainstorming just because it's fun, but collaboration. If you're a coordinator, this evaluation challenge, I believe, is the type of challenge that's a challenge that a village needs to solve, right? You're not going to fix that by yourself because there's too many other people involved, right? That collaboration is key.
Collaboration is key because, like, you can only think of it one way, maybe two ways, maybe three. But when you have people from different backgrounds, different, settings, how they think, young, old, everything, you get different ideas. And when you merge those together, you're doing things and you've come up with a lot of things that you never thought before, which makes it easier. One, you know that your team has your back. They're helping you, right? When you collaborate. And then when they do give you the ideas and the information to say, look, why don't you try it this way? You're not by yourself, right? And you have additional resources. And so you get it together, you take their ideas, you formulate it, you process it, you send it out there, and you just never know from there. But collaboration is key, especially when it comes to evaluations. We know that evaluations are the hardest thing to get back from the outside physicians, is the hardest thing for them to sit down and do. So when you have other people brainstorming on these ideas, that's where we need to really focus on that collaboration with your team and outside your team. Even reaching out to faculty like, okay, how can I help you fill these out for us?
Right. Right. And I think it's great, if you think about, and Natasha, you're such a big person in terms of elevating all the coordinators in the industry. And listen, we saw the polls right there. Some of you have set your KPIs really high, right? So those are the people you want to be talking to, right? They're raising the bar. All right, let's take a look here at our next slide. So we went through the brainstorming. Brainstorming exercises are always fun, but then of course it's where the rubber meets the road. So where do we go next?
Right, and this is what I was talking about, gathering, all the information and feedback. And it just hit me, Marcus, something of what you said about, if the coordinators already have a system, and it works for them and they're getting their 80-90%, reach out to them. Maybe you could open up a discussion with them. How are you doing this? Especially, with the systems. So getting this information back. So when you're in your program and you figured out, you've done your brainstorming, you did your collaboration, you have stuff together, take all this information, and then we're going to say, okay, let's try to take all this feedback, put it into a plan, and then put it out there. Let's see if this particular plan will work. Is it something that does it address all the issues that we know that we have, and then move forward. So
right.
It's a cycle.
And I think also, and whenever we talk about process improvement, one of the things that I think I would make sense here, Natasha, and tell me if you agree, is there's a lot of different levers we can pull, right? We can reach out to different people, we can reach out at different times, we can reach out in different manners. From a statistical analysis standpoint, those are all great ideas. But I love your idea about prioritizing potential solutions, because you probably don't want to test all those at the same time, right? Because then so that's where you're getting at from prioritize. It's sort of, we would test this hypothesis and then test this one, correct?
Yes. And I always do things for 30 days. So it's like if I get a suggestion, even from one of my coordinator friends, hey, have you thought about this? No, I haven't. So guess what? I could be in September now. So I could be like, you know what? I'm going to put this together. So that way, October 1st, I'm going to implement it to see how it works for me, right?
Yes.
Because I always go back to work smarter, not harder. So if one, I don't have to invent the wheel because she gave me this idea. And then two, let me formulate my plan before I even set it in motion. I may even take it to my PD or APD. What do you think about this? I got this idea about this. They may be like, oh, yeah. They may add something to it, spice it up a little bit. And then, we formulate it the next month and see how that goes. So you always want to prioritize. You don't want to have like different things going in the mix. First, you don't want to do that because then it will just be a chaos. And then the timing of the season, we have our highs and our lows. I like to really try it on our lows. So that way I'm not interrupting anything. And I can see how it turns out, because if it's a high season, I may get frustrated, stressed. That's not the time that I like to do things.
There's a lot of great tips there. So let's break those down. It's think about the timing that you're doing this. It may not be an appropriate time to test. I love the idea of, look, you got to let the test run 30 days. When we take a look at the volumes that we deal with, it's really important to realize that from a statistical significance perspective, if your program only has a few dozen residents, you need data, right? So this is not the type of thing that you want to try something out for 5 days or 6 days. 30 days is that's really clever. I like that. As we move on to the next slide here, which talks about those evaluation completion percentages as well as evaluation content quality. I've got some questions for that. But Carla has a great comment in here, and I love this because it's almost like Carla has what I would call a waterfall approach, where she says, I only ask my residents to provide me with the preceptor's name and email address, and then she follows up every week. If that fails, I include my PD to stay on top of the outside institution's PD. So it's a waterfall technique, right? It's trying this, and just layering on right there.
You have to.
We haven't talked at all in this program, and we only have a few slides left. But we focus so much, and it might be my fault because I love numbers, that we focused on completion percentage, but we haven't talked about content and quality. What are some tips that you have there, or how do you evaluate quality, and how do you think about improving quality?
Quality. Marcus, it really goes back to the giving it the 30 days or more, right? You got to think about like the content and quality. The content is the evaluation, right? So I like to periodically do audits, right? So I'll perform a regular evaluation audit, is what I call it. This is just to ensure that all my evaluations are being completed accurately, because sometimes you may even need to put different milestones for each specific rotation. You may have a sports rotation, a pain rotation, a dermatology rotation, and they all do not have the same milestone questions, right? So you want to think strategically about the content of the evaluation, first of all. And then sometimes we may, after like a year or two or 2 years, sometimes the resident or the outside doctor may say, well, these really didn't pertain to this rotation. So, you have to go back in and change it just to get, a good content, quality of evaluation that you need, right? So I'll do that from time to time. So these audits, when I do my audits, right, they help me identify like any gaps, any discrepancies in the evaluation process, whether it's for me or outside, such as missing evaluations. Did they not turn it in? Incomplete documentation. Are the residents, did the doctor really sign it? He filled it, but did he sign it to push it over? Because sometimes it can be stuck. Did the residents see it? They sign it? Just all different types of things to ensure that we are getting the best documentation that we can for our residents, right? And these areas are where the evaluation is critical. It may not be aligned with ACGME competencies. So if they're not, then let me get that evaluation back on track with ACGME competencies, right? So when I think about the evaluation process, the evaluation completion of it, I have to verify, I'm verifying, I'm checking, I'm ensuring that everything is assigned to the evaluators. And so that's where the quality comes in. are you putting in quality work to get out quality results, right? And you
Right.
have to confirm that all the residents and the fellows, and they have completed even their self-evaluation or their peer evaluation. And do those questions line up with what you want to know about that resident? And it all goes hand in hand. I have a checklist that I created, and every time I'm looking at evaluations, I ensure all of these things and more. But then when it comes to CCC, I'm able to take not just my checklist, but I'm able to make sure our CCC meetings have all of the pertinent information that they need. And then again, when it's time for final evaluations, it just makes it smoother for a program setting. Even with our PECs, all of this information is pulled, all the data is pulled. So when you think about the quality aspect of it, it's less work because
Right.
the first end, great. So that's just what I do. I know some people think it's like more work, but when you think about it, maybe on the front end, but when you get to that back end, it's so easy, streamlined.
It's interesting as I hear you talk and as I see the comments coming in from Carla. Again, Carla, thank you for your comments. It's about continuous improvement, right? Like it seems like a lot of work, but it's not unlike physical fitness, right? The trick is you got to do a little bit every day, and that's really how you get better. You actually teased the audience a couple minutes ago. You mentioned your checklist, which is actually coming up next, which is great because I know we've got some new coordinators on the program today. And one of the things and the reason we always encourage people to follow you online is the templates and tools and processes that you put out are outstanding. Walk us through this is it. This is Natasha's evaluation process audit checklist. Walk us through this.
So I do this with with different evaluations, right? So I will, and I formulated this when I really got into coordination because I kept missing different things, right? And that's why I talked about also the ACGME, what is that called? The check the yearly, the timeline, right? So it really goes hand in hand. So when I'm sitting down, either before CCT to gather evaluations, and I like to do this months ahead, just in case I need to reach out to, the outside rotations for these. But this is what I'm doing. So the evaluation completion, that I verify that all the requirement for the evaluations have been distributed, let me make sure. And I'll go through every so months just to make sure, because you will be surprised how many times I found a rotation was not, I don't know, something wasn't clicked and the site directors were not getting the evaluations, right? So checking up on that. I have a calendar and I will set, this particular day and this particular month to go and check all of that, and this is just, and honestly, this is like a 2.5 page, but that's just me, 2.5 page checklist that I do periodically to ensure that my evaluations are correct, that they're set up right, that the form, do I need to update the evaluation forms? Is the quality of my work, is the quality of the forms, are they up to date? Is everybody like am I getting back? What does the feedback look like? So this is just a snippet of what I look at and check and make sure.
Outstanding. And we got a question come in from the audience saying, can I get a copy of the audit with the recording? So Natasha, if you can ping us with a Word doc or PDF, we can include that in there for the audience as well.
I sure will. I'll make sure you have it.
Wonderful.
Now don't talk about me, guys, because I know that I do extra steps, but that's only because my job and my everything that I do, my work ethic speaks for me. And so when I do these things, I want people to know, like, my work is quality. And, my work ethics are me. So I'm going to send it. So please spare me.
Thank you so much. We appreciate it. So listen, Natasha has been, as always, so gracious with her time, so helpful today. Let's take a look at everything we've learned. Look, it's all about making sure we have to actually design those evaluations based on those ACGME guidelines and the Ryme framework, which Natasha shared with us. I love it. I think it's useful, and I encourage everyone to use it. Know or establish those KPIs. That's key, right? We want to know what those KPIs are. Now, we also didn't put anybody on the spot today and say, where are you right now? But guess what? That's part of the exercise as well, is once you've established that KPI, now we got to be monitoring that, which actually brings me to another question that I'm going to have for you in a minute. Please feel free to get your questions in. We're nearly at the Q&A portion. I've got a couple for Natasha myself. And then once you know that KPI and you know where you are, then that's where we want to optimize and improve those. This is my last little advertisement slide, and then we're going to do Q&A. So please keep those Q&As coming in. So listen, if you want to learn more about the Medtrics software, and as specifically we've been talking today about evaluations and assessments module, you can scan that QR code right there, and you can schedule a member with our team. We're also going to be sending out email recordings. You can feel free to ask questions about the software as well. The team would be more than happy to work with you and help you see how Medtrics might be able to help you with everything as it relates to medical engagement software, medical education software, in particular as it relates today, evaluations. Now, I do have a question though, Natasha. I've actually got two questions for you. I'll ask you the simple one first. The simple one is because of the way academic seasons run, if I decide, okay, I'm coming out of this webinar, now I know my KPI, it's 85%. How do you tend to break down when you're compared? Do you look at each month at a time? Do you look at a semester at a time? How does Natasha find where I am right now to compare to her KPI? How do you think about time?
You know what? I actually do it maybe 2 months before our first CCC. That's when I have time to really go back and look, right? So I know CCC is coming up. I start to prepare for CCC. So that way I can look back. This is what has been going on for, like, say 2 years, right? Our year before and our last one. Okay, we are doing better. What can we do to improve? This is just what I ask myself. What can I do to improve? How can I improve this? So when I know CCC is coming up, I always mark my calendar 2 months ahead of time to get that together and then do that research.
Outstanding. It's a great answer. Thank you. Thank you for a very pointed answer, which is so useful. My final question for today is, we've been talking about how to improve evaluations. And whenever we talk about system improvement, and we talk about this a lot at Medtrics, we always break it down into sort of 3 buckets: people, process, platform. People meaning you've got to get the right people in the room talking about the problem. The second is process. We have spent a lot of time today in terms of how we improve processes. That's where we got some great comments from Carla. We got some great comments from you, Natasha. And then the final one is platform. And I put in a few tidbits there of things you can do inside the Medtrics platform. When you think about improving your evaluation percentages, people, process, and platform. From your experience, Natasha, is there one of those 3 that you go, well, I definitely would start here? I would look at your software first. Should we change our technology, or should I look at the process or the people? How do you think about people, process, platform?
Actually, for me, I go process first, only because besides the mechanical process, I can look at my own process to be like, first of all, is this working? Because why would I reach out to the people if it's what I'm doing, right? Why would I look at my improvement or people, process, and
Platform?
Platform. Yeah. Why would I look at my platform if it's something that I'm doing? So I would do the process first. How can I improve it? What can I do? And then once I've done all I can do, I will brainstorm with the people, right? And then after we brainstorm, there may be something that in the platform that we need to work out, look at, or adjust, right? So I would go there because 9 times out of 10, with our evaluations, and every program is different, every specialty is different. You need to figure that out first, what you need to do. And then it's the outside faculty. That's why it's people next, because do you have to chase them down all the time? Right. And then what if that's the case and we need these evaluations because it is part of our policy from ACGME? What can we do? Like, is there a platform where everybody can use it? Everybody, you know, in every residency, every state can use it to make it easier for everybody. I know faculty, they're busy, they don't want to sit down, they don't want to answer those questions. So how can we really make these evaluations easier and simpler for them, since it's taken out of their day, to fill them out for, the residents or the medical students? That's the order that I would go in.
I think that's very, very, very well said. And I think a final point on all this too, because we've spent a lot of time talking about chasing percentages, is certainly be aware that the smaller your program, the more one evaluation really moves those numbers. So you need to look at not just the percentage, but both the numerator and denominator in that equation as well. Okay. Natasha, this has been so much fun. Thank you so much for joining us again today.
Thank you for having me. I love these.
Wonderful. Well, we're thrilled to have you today. Hey, everyone. Michael just launched one final poll. We're asking you 2 questions. Real simple. Rate today's program 1 to 10, meaning 10. Oh my goodness, Natasha, where have you been all my life? Let's do this every day. 1 meaning, hey, you wish you would have gone, and I don't know what you would have. Don't give us a 1. That would just be terrible. We're certainly not a 1 today, Natasha. I don't think so. The second question that we have here is, hey, would you like to have a conversation with Medtrics about what you're currently doing from a medical education platform standpoint? Certainly the team at Medtrics would be thrilled to talk to you about it today. That's all we have for the program today. Natasha Brox, once again, thank you so much for joining us. You are wonderful for our audience, and we were thrilled to have you on the program today. Feel free to use that QR code. Visit us at medtricslab.com. For everyone on the Medtrics team, I'm Marcus Grimm. Have a wonderful rest of your day.